Hi, I'm Dr. Sharath Babu Nilgiri, consultant Arthroscopic surgeon working at Care Hospital, Gachibowli. So today we'll discuss about frozen shoulder. We commonly see this in lot of people. So in OPD, so people will come with a very stiff shoulder, having lot of pain and difficulty in doing overhead activities. So we'll discuss about the frozen shoulder today. Coming to the anatomy of the shoulder joint. So shoulder joint it's a joint formed between the humerus, ball of the humerus, and a glenoid, a cavity of the scapular bone. So between these two bones, a shoulder glenohumeral joint is formed. So other joints involved in or around the shoulder joints are clavicle and acromion. Acromioclavicular joint is also there. So that also will help for some stabilization of the shoulder. Actually, the shoulder joint is not like a complete ball and socket joint. It's very shallow in shape. The glenoid is very shallow in shape. So that to allow the complete full range of movements of the head, like full 360 degree, allowing the full 360 degree movements. So for allowing those movements and giving the stability won't be sufficient. So for that, lot of soft tissues will give the stability to the shoulder joint. So it is a complex joint. It gives a versatile movements, and there are a lot of ligaments and muscles involved around the shoulder joint to give the stability. We'll look into the causes of the frozen shoulder. We commonly see frozen shoulder in patients who are having diabetes for long-term duration. So next, in patients who underwent surgeries around the shoulder joint for any fractures or in the upper limb, or who are immobilized their shoulder for long duration, so because of pain, they develop frozen shoulder over a period of time. So that may be a cause for a frozen shoulder. So next thing will be who are having an injury around the shoulder, and they have neglected it for quite some time, so they also have chances of developing a shoulder frozen shoulder. And in people who are having a tear in this supraspinatus or rotator cuff muscles which are attaching over the humeral head, in them also pain will start because of the tear, and they are not able to lift their shoulder because of pain. Later they develop the frozen shoulder, like stiffness in the shoulder. So these are the main causes of the frozen shoulder. So treatment options for the frozen shoulder are, first thing is evaluation is very much important. So we need to rule out whether patient is having only frozen shoulder or any other pathology inside the shoulder. Pathology means any ligament injury, like cuff, rotator cuffs, what we call as four muscles will come and attach over the shoulder, humeral head. They form a cuff like thing. If any tear in the rotator cuff, that we need to rule out first, or any pathology in the any biceps pathology, rotator cuff pathology, all those things we need to rule out first. So if it is only frozen shoulder, rest all the ligaments in the shoulder are fine. First we'll give a period like medications, and we advise the patient to go for a consult a physiotherapist for the pain relief and to increase the movements. That is what physiotherapy is. So with this, if patient is increasing, that is well and good, no issues, so they can continue those exercises. In case after 2 weeks of the physiotherapy and medications, if patient is not at all improving, what we'll give injection in the joint, that is called hydrodilatation. It is a procedure that increases the volume of the capsule. Capsule is the layer which surrounds the shoulder joint. So because of the frozen shoulder, the capsule shrinks in size. What we do with this injection, we'll dilate that capsule with some analgesics and with normal saline. So with that, the gap in the capsule will increase so that the patient can move his shoulder, and pain also will subside with the procedure, hydrodilatation. So that is also one option. So 80 to 90% of the patients will recover very well with the hydrodilatation if it is done in an early stage, like not neglecting the frozen shoulder for 3 to 4 months and coming with a very stiff shoulder. Hydrodilatation also may not improve those patients. So next option will be like in the patients who are having a failed physiotherapy session and hydrodilatation is also not working, or patients who presents very late to the clinic with a completely stiff shoulder without having any movement at all. Then in those patients, what we do is we do a arthroscopic procedure. That is a keyhole surgery which will be done with the 2-3 holes around the shoulder joint. We will release all the adhesions and we will improve the movement of the shoulder. So this is the end complete. If frozen shoulder is completely not treated well for longer durations, then the surgery is the only option. So when to consult a doctor is the important thing. So initially, if any sprain or pain starts, you can see for 3-4 days or 5 days by doing all the home remedies like ice pack application, any medications, and giving rest for some time. If it is not improving in 4 to 5 days, then definitely you need to consult a doctor. Basically, we evaluate, first thing to evaluate is any fracture is there or not, we'll rule out. Later, if movement restrictions are not there and only pain is the complaint, then we'll give some medications, and later if the pain subsides, exercises. So depending on the evaluation, we'll be knowing whether there is an intra-articular pathology, like in the shoulder joint any pathology is there, any tear is there. Depending on that, we may advise a MRI to rule out any tear is there. So best to consult a doctor in a week's time if pain is not subsiding after the rest. For frozen shoulder, we see in lot of patients. So basically they neglect their upper limbs because they can work in this region. Lot of people, they don't have this overhead, they don't need overhead activities for they'll be okay doing movements, these kind of movements, and they'll neglect the shoulder and then present very late. So first thing to rule out is any cuff tear. That is, if cuff tear is there, if you are neglecting your shoulder, you are not moving your shoulder for longer durations, that rotator cuff may retract inside. So later repairing that tear is very, very difficult. Sometimes we may need to go for a replacement surgery. So better to avoid those conditions and avoid those complications. Go and consult a doctor immediately whenever you present a pain, at least in a week's time, so that evaluation will be good and you won't have a major complications. Thank you.